Following months of heated debate and closed-door negotiations, Congress finally cast a historic vote and passed a sweeping healthcare reform bill into law. Those in favor of the supposed reforms touted their good intentions of ensuring quality healthcare to all Americans, as if those against the bill opposed good medical care itself. In reality, the legislation included unprecedented corporate favoritism and is certain to lead to higher healthcare costs, setting the stage for further government intervention in the future as well as the continued decline of our healthcare system.
When you look at the final version of the bill, there are many provisions in that bill that help the drug industry while hurting patients.
The most troubling aspect of the bill is the personal mandate, which rewards big health insurance companies by forcing Americans to either buy their product or answer to the IRS. This begs the question, should the IRS be given more reason to exercise its power over American citizens? A number of states have filed challenges to the mandate's constitutionality, and many more are considering taking action to nullify measures they deem beyond the federal government's scope.
Today, Delaware became the 41st state to introduce legislation or announce their intentions to introduce legislation that would prohibit an individual requirement to purchase health insurance.
Nullification has a long history in the United States, but not necessarily the one you may have learned in school.
In 1798, we got the Virginia and Kentucky resolutions of that year that made clear that the states retained this power to judge for themselves of the constitutionality of federal laws and to reserve the right to refuse to enforce them if they went beyond the federal government's delegated powers.
Whether states will successfully reassert their constitutional responsibility to protect their citizens from an out-of-control federal government remains to be seen. Let's hope the outcome is good for individual rights and a step in the right direction.